And we think about it all the time, and like this idea of informed consent, informed consent, when somebody walks out and they're like, so the risks of surgery are bleeding, infection, nerve damage, we could injure you, you could have wound healing complications, you could have a DVT, a PE, or heart attack, stroke, or death. Sign here. Right? Like so I think with all of that, there is no question that there is a crudeness to it. There is sort of a like barbaricness to the concept of surgery. The flip side is that well done operations are an orchestra. I mean, they are beautifully orchestrated things, and the number of people working together, this is like a race car pit crew, fast moving, super efficient, super thoughtful, really, really well orchestrated. There just aren't many things in life that you can see that many people working together when the pitfalls are in every turn. You go left, not right. At any point of that, a big, big, big problem happens. And it really, really rarely happens. So I think the thing that dawned on me that really changed my pathway in medicine is that I realized in medical school that people are so obtuse and unaware of the risks of medications they take. We have such a good sense of the risks of surgery because it's tangible, but like people put anything in their bodies. Like people will take a pill and that has no risk, right? Like these are some toxic things. And at least surgery, to me, it always felt like the preparation and the skill set that goes in it can mitigate the risks. There's nothing we can do about the risks of a pill. If I give you some sort of medication to take, that is the risk that the pill has with your body. I'm giving it to you, and whatever happens, happens. That to me is horrifying, right? But for me, the idea that I'm in control, it's like, do you want to be in a self-driving car or do you want to drive the car?
Right.
And for me, like I feel more comfortable having the wheel.
Yeah.
And so for me, surgery, as crass as it might look, all those risks are controllable. I mean, if you handle that appropriately, you are decreasing that risk. And I didn't have that opportunity in some of the fields that were medicine based.
Do you think that people who enter the field enthusiastically for whatever reason, like parents or whatever, is there some percentage that they get to that moment of learning where it's just
Like,
yeah. And there's a moment, there can be moments all the way through. I mean, it's amazing. We sometimes, you have people who did college pre-med courses, medical school, get into residency, and you're talking about a decade of additional training. And then somewhere in residency, they're like, and I think I'm going to go be a banker.
Yeah.
And you're like, really? You did it. So that moment can come at any time that you either say, this isn't for me, or this part of medicine isn't for me. I think it's one of those things that, we don't have any medical people in our family really. No. And so I didn't know much about this, but I guess one of the things I've seen on this end is how many people find really good pathways in medicine, even if it's not being a doctor. Mm-hmm. Mm-hmm. And there's a lot of ways you can contribute medically in research or in industry or in whatever. And so, there's a lot of ways that if you find that providing patient care itself is not for you, which more and more doctors, honestly, I think are these days. Mm-hmm. I mean, I think there's a real challenge right now that the pressures on physicians to see, especially medicine doctors, less surgeons, but the pressures to see more patients in less time, to get them in and out, to be seen as sort of how many did you get through in a day as the metric to success. Like that is just, when you look at medicine that way, it's a pretty unappealing pathway for people.
Yeah.
But I don't know. I mean, I think that's always been the beauty of surgery is it's such a privileged position, right? You close the door and you don't have your email and you don't have anybody pinging you. You've got a job, and it's like anything else. You get to be singularly focused.
And what's the
in
most
life.
fulfilling thing about it? I mean, what's the thing that, like, what's the best feeling?
So for me, every single surgery you do, you go in knowing what the point of that. If you're doing it right, you've prepared in a way that you know what the singular part of that surgery that's going to be the hardest is. Every surgery has one. And that's the way I prep for cases is I look at the imaging and I say to myself, where is it going to be closest? Where is the part that I'm too close to the spine here and I'm too close to the tumor here and I only got a millimeter to work in? Like that is the part. And so for me, the part of surgery that is the best is when you get to that. It's actually not when you beat that part. It's not when you're past that part. It's when you get to that part and you say, I knew this was going to be my challenge. I'm here. I see it. And this is exactly where I expected it. That feeling of saying now it's just a performance issue. Like now it's just getting through it. That's never, but that I went in knowing exactly what was going to be the tight aspect of this for me is the best part of the case is just sort of this feeling of I prepped for this part. I know this part is here. I know this looks close and I totally know what we're going to do to get through this part. That's just like
truly psychotic. That's the best part. Nah, like that's crazy. That would be like horrifying. Like, so like the part where like if you make a fuck up
that's
there,
the part you train for.
Yeah.
Like that's the part. So it's the best part because you know